Let's talk about Thoracic Outlet Syndrome, TOS, and the surgery that can help. TOS happens when the space between your collarbone and first rib, called the thoracic outlet, gets too crowded. This tight space can put pressure on nerves and blood vessels, leading to problems. Think of it like a kink in a hose. It disrupts the flow. What causes this crowding? Sometimes it's due to something you're born with, like an extra rib, a cervical rib, or other bone differences. An injury, like whiplash from a car accident, can also cause it. Repetitive arm movements, especially overhead, can irritate the area. And even poor posture, like constantly slouching, can narrow the thoracic outlet. So, how do you know if you have TOS? The symptoms can vary, but common ones include pain in your neck, shoulder, arm, or hand. You might also experience numbness or tingling, often in your fingers. Some people feel weakness in their arm or hand, making it hard to grip things. In more severe cases, your hand or arm might feel cold or even change color. If physical therapy, medication, and other non-surgical treatments haven't helped, your doctor might recommend surgery. The goal of TOS surgery is to relieve that pressure on the nerves and blood vessels. There are a few ways surgeons can do this. Transaxillary approach. The surgeon makes a cut in your armpit. This approach is good for reaching certain areas of the thoracic outlet. Supraclavicular approach. The incision is made above your collarbone. This gives the surgeon a different angle to work in. Infraclavicular approach. The cut is made below your collarbone. This approach is sometimes used for specific situations. Your surgeon will decide which method is best for your specific situation. They'll consider what's causing the compression and which structures are involved. What can you expect before, during, and after surgery? Before the operation, you'll have a thorough checkup. This might include physical exams, nerve tests, and imaging like X-rays or MRIs. Your doctor will give you instructions about medications to stop taking and when to stop eating and drinking. During the surgery, you'll be asleep under general anesthesia. The surgeon will make the incision based on the chosen approach. They'll then carefully remove or adjust whatever is causing the compression, whether it's an extra rib, scar tissue, or part of a muscle. Afterward, the incision will be closed with stitches or staples. After surgery, you'll likely stay in the hospital for a few days. You'll have pain medication to keep you comfortable. You might also have a drain to help remove any fluid. Physical therapy will start soon after surgery, even while you're still in the hospital. This is super important to help you regain strength, flexibility, and range of motion in your arm and shoulder. The early recovery period after TOS surgery is all about healing and regaining function. You'll need to take it easy and avoid strenuous activity for several weeks, maybe even a few months. Listen to your body and don't push yourself too hard. You might still have some pain, numbness, or tingling as you heal. It's normal to have some discomfort, but it should gradually improve. Your surgeon will give you specific instructions on how to care for your incision, what activities to avoid, and when you can start returning to your normal routine. Remember, everyone's recovery is different. It's crucial to follow your surgeon's advice and go to all your follow-up appointments. If you have any questions or concerns, don't hesitate to reach out to your doctor. They're there to support you through the entire process. TOS surgery can be a very effective way to relieve symptoms and improve your quality of life, but it's important to have realistic expectations and be patient with your recovery.